Cardiac power intervals are some of the most high intensity intervals that we can do to improve your conditioning. And what we're going to really focus on with these is trying to get your heart rate recovery to improve. So we want you to use a method where you can spike your heart rate as high as possible whenever we are working. So this is going to be a really 10 out of 10 for your RPE. You're going to be absolutely blowing for it, and we want to then get our resting heart rate recovery time to drop. So the trick with these is we're going to be going really high intensity, and then after we expose ourselves consistently to these intervals over a number of weeks, you're going to notice that your heart rate is going to recover faster, and that's going to mean that your aerobic system is able to work more efficiently to get all of that kind of lactate and the anaerobic byproducts out of the system so that you're ready to go for some more rounds. This is a really high intensity method. We're going to be typically doing around about 3 to 5 reps and 1 or 2 series of 3 to 5 within your workout. The work to rest will vary, but we're usually going to go for about 1 minute and maybe between 1 minute and 2 minutes for these. Whenever we are getting fitter and fitter, we can reduce our rest period to whenever your heart rate comes back to around about 120 beats. However, to start off, I'm going to definitely encourage you to take a longer timed rest for around 3 to 5 minutes typically, depending on the intervals that I give you. For the method of exercise that we use for these, we're going to try and make it as specific as possible to your goals. So if you are a cyclist, we might do some fan bike because it's a little bit easier to get that heart rate peaked, but it's still a little bit more specific to cycling. Or if you are, for example, a rugby player, we might get you doing some repeated shuttle runs or hill sprints, just so that you're able to get that heart rate really peaked. It has to be as maximal as possible for your work periods, and then we're going to have a very low active recovery. So that's your cardiac power interval method.